What if you've said yes to becoming a surrogate, you've matched with great intended parents, we'll talk a little bit more about matching soon, and now you've got that medical screening date locked in your calendar and it's approaching. You're not exactly worried, but your brain starts going, what if they're looking for something I don't have? What if something comes up that I didn't know about? That kind of uncertainty can really start to spiral. Even when you feel confident in your body and that you're going to pass, not knowing what to expect can make your mind race. Will my medical history be a problem? How can I get ready? What if I make it this far and they say no? Yes, medical screening is intense, but it doesn't have to be intimidating. When you know what's coming, you'll feel way more calm and in control walking into that appointment. That's why we're here. This is part 4 of the Quick Start Guide, and we'll be walking through what the screening and medical process actually looks like in plain, simple language. You don't have to remember every last detail. This is just a highlight reel so that you feel ready when the time comes. Let's get into it. There are 3 stages of medical screening. Stage 1 is the first round of screening. We've already heard about the basic qualifications back in part 2. That was things like age, BMI, pregnancy history, lifestyle. If you met those, then you move on to the next level of screening. Stage 2 is the REI fertility doctor review. Your next step is at the fertility clinic with the REI. REI stands for a reproductive endocrinologist and infertility specialist, aka fertility doctor. This is the doctor who will oversee the medical side of things and the procedures to help you get pregnant. Before they approve you to carry a pregnancy for someone else, they have to look really closely at some important things. This includes your full pregnancy and delivery history, your medical records, any yellow or orange flags or question marks that come in during your intake, and a clearance letter from your OBGYN saying that it's okay for you to have another pregnancy, this time as a surrogate. What they're doing in this step is making sure that your body is in the best possible place it can be to carry a healthy pregnancy, both for your safety as well as for the baby's. Stage 3 is on-site medical testing. If everything looks good on paper, everything checks out, you'll be asked to travel to your intended parent's fertility clinic for full in-person screening. Now, every clinic is a little bit different in terms of the testing that they do, but it can include things like a physical exam, an ultrasound, even a saline ultrasound to check the inside part of your uterus, blood work to check your hormones and overall health, and possibly other lab tests and in-depth exams. You'll usually do all of this in one visit, but you'll get lots of instructions ahead of time. Once the medical part is moving along, you'll also have psychological evaluations. Sometimes you actually do this the same day as your on-site medical testing. The psychological evaluation is to make sure that you are mentally and emotionally prepared for surrogacy. It's usually a video call, although sometimes it's done in person. You meet with a licensed therapist who understands surrogacy, who knows what it takes to be a gestational carrier. You may be asked to fill out a personality or a mental health questionnaire. It's all part of protecting you, your interest, and the family that you're going to be helping. There's also usually a background check, and it's done on you and sometimes your partner or any adults that are living in your house. This is pretty standard, and it helps everyone to feel safe and secure about moving forward. Next up is IVF and medications. Let's talk about how pregnancy actually begins. As a surrogate, you're gonna go through a process called IVF, or in vitro fertilization. This means that an embryo is created in the lab using the intended parent's egg and sperm, or sometimes donor egg and sperm. Once the embryo is ready, it's transferred into your uterus through a quick procedure done at the fertility clinic. But before that can happen, your body has to be fully prepared, as if it was already getting ready for a pregnancy. This is where medications come in. You'll take hormone medications to thicken the lining of your uterus, like the inner part of your uterus, and it's going to mimic your body in what it does during a normal hormone natural cycle. This is how the doctors create the best possible environment for an embryo to grow. These medications can include estrogen and progesterone, and they're usually given by injections, patches, or vaginal suppositories, so medications taken inside your vagina. And when we say several weeks, let's be real, it's often 2 or 3 months of daily injections to get your body ready and to support the pregnancy, especially in the early weeks after transfer. Everything is very detailed, very timed, it's well orchestrated. You're gonna follow a medical calendar, sometimes called a protocol, and you need to take each medication at the exact time listed. It's not something that you can just wing or take lightly. You're also gonna be doing a lot of ultrasounds and lab work along the way to make sure that things are working. Unless you did IVF for your own pregnancies, this part will feel very different from getting pregnant naturally. But you'll have full instructions from the clinic, and of course, here at Junie, we have resources to help guide you. Temporary restrictions. There are also a few rules during this phase that most clinics will ask you to follow. So that includes pelvic rest, meaning no sex or even orgasms for a few weeks, no strenuous exercise or heavy lifting, and then following the medication schedule exactly. This part is really, really important, which is why I'm saying it again. Every step is designed to give the embryo the best chance to stick and grow. That's what we all want. Whew, okay, so that was a lot, but remember, you don't have to memorize all of this. You have time to dig into the details later. It's just good to peek ahead at what is coming. So what is next in our series? In part 5, we're gonna be talking about a huge topic, which is compensation. How you actually get paid as a surrogate, what's included, when payments happen, and how to make sure your money is protected. You don't want your payments to be messed up, so I will see you in part 5.